Hello. I begin my address today with the demands of the communities. Nothing about us without us. With over a third of the world's population aged between 10 and 24 years, today's generation of young people is the largest in human history. As the future leaders and drivers of growth, productivity, and innovation, young people are our greatest assets. Investment in their health and well being, as well as harnessing their potential as agents of change, is vital to efforts to end deadly epidemics such as TB. TB remains the world's top infectious killer. Young people between the ages of 15 and 34 are disproportionately affected and carry among the heaviest burdens of the disease. They are also often the largest population group in the developing countries, with their role and potential contributing immensely to a nation's social and economic capital. Enabling their access to care and ensuring their meaningful participation in efforts to end TB at all levels will pave the way to a better, safer, healthier world free of TB. Currently, the potential of youth has not been fully harnessed in the efforts to end TB. Peer pressure, fear of stigma, risk behaviors such as alcohol, substance and tobacco use, and co-infections such as HIV create challenges for this age group, both in understanding the symptoms, the risks, and seeking help for TB diagnosis and treatment. One critical point of action that continues to be missed is engagement with the youth from affected communities. The concept of a human rights based response to TB is relatively new. And to make this a reality, we need people from the affected communities and especially youth from the affected communities to be engaged at all levels. Most often than not, children and the youth are left behind in the highly medicalized TB response. This is a huge gap that needs to be filled. It is more than evident that youth are a huge untapped resource. With the right guidance, they truly can transform the TB response. We, as the Global Coalition of TB Advocates, believe in this. As a part of the efforts to engage youth in the TB response, today, the GCTA is bringing to you this very timely session. If we are committed to engaging the youth in the fight against TB, we need to hear their voices. They must have the agency and resources to sit on the same tables as other stakeholders and design a TB response that is people-centered and rights-based. Today, our speakers will represent different regions of the globe and present their perspectives to move us forward towards a rights-based TB response at all levels. First, we have Parmata Silitonga presenting perspectives from Southeast Asia. Secondly, we have Lourdes presenting her perspectives from Latin America. Our third speaker, Fumeza, will be presenting her perspectives from Africa. And our fourth speaker for today is Muhammad, who would be presenting his perspectives from Eastern European and Central Asia. I would like to now hand over to my speakers. Thank you.
Hello, my name is Permata Imani Maslitonga. I'm a associate board member, Youth, for Global Coalitions of Tuberculosis Activists, or known as GCTA, and also part of the youth movement against tuberculosis of Indonesia, known as IMUT. So today I would like to present the Youth Engagement Challenge and Way Forward Southeast Asia. So, based on the Global TB Report in 2020, most of the TB cases in the WHO regions of Southeast Asia, which is like 43% after, and then there's Africa and the Western Pacifics. However, when we can see the age distribution of the TB incidents, most of the cases was in the youth age, which is like 15 until 35 years old, which is like youth have a big role for anti-B in the world, and we need to engage and provide the meaningful youth engagement to let the youth can contribute to anti-B. So in 2019, WHO established the TBU Town Hall in Jakarta, Indonesia. Uh, until now, it's the only one TBU Town Hall. So basically, a lot of youth gather in Indonesia, in Jakarta. We discuss a lot how we can contribute and how we can MTB together as youth. And we create the youth declaration to MTB. However, until now, we do not find any follow up actions or any sustainable funding for us to actually give the move and actually give the action for the proposed declaration that we already gave in this event. However, in Indonesia, after the event, we create the independent initiations of Indonesia Youth Movement Against Tuberculosis. And through this movement, we already conduct several things such as campaign about tuberculosis through this community and also like the college students. We also initiate the landscape and exhibitions of RTB. So we match the survivor of the TB patients with the artists who create the art or painting regarding about the TB and tell the story behind that, which is like the story of the TB survivor. And we hope through these exhibitions can increase the awareness through art to all of people regarding about TB. And we also collaborate with several organizations, for example, like CHIMSA is the Medical Association students to give the webinars and also like raising awareness about the tuberculosis and give the evidence how we as a youth can give the big contributions to NTB in Indonesia and also in the world. So that's all from my presentations. Let's end TB together. Thank you.
Hello, everyone. I'm Lourdes Cruzado. I'm from Peru. I am associate board member of the GCTA. I am also a member of Partners in Health in Peru. I am currently in my role as a monitoring and evaluation lead of a multi-country TV project in Latin America and the Caribbean. The purpose of this project is to reduce barriers to access to TV service for the key population in the LAC region through civil society organizations. In this opportunity, I will talk about the challenges of youth participation and the way forward for the fight against TB in Latin America and the Caribbean. I don't report conflict of interest. You can see in my first slide that in LAC in 2020, the PAHO estimated 291,000 TB cases. However, only 197,000 cases were reported, less than 17% of the previous year, showing a gap of 93,000 people between what was estimated and what was reported according to PAHO. It should be noted that not all LAC countries have information by age groups. It is evident that in my region, we continue to have serious difficulties in detecting cases and starting treatment in timely manners. However, strategies have been generate to NTV. We note that a concerted and comprehensive response is necessary from all key actors such as the government, civil society, and above all people affected by TB. This comprehensive view goes much further than biomedical care. We need to address issues such as stigma, gender, human rights, social protections, and focus it on key population. But in order to achieve all this, we also need to involve the youth. We are key pieces for social progress. Historically, young people have led the world forward with their drive and vision for social justice. Young leaders have the potential to transform the world with their communication skills and their ability to mobilize others. So, social media, they can have a multiplier effect in the fight to the NTB. Young people are also the main beneficiary of the 2030 Sustainable Development Goals, including the target to NTB, as they can inherit a better, safer, and healthier world. We can hold leaders and organizations accountable for their actions to achieve the commitment to NTB as set forth by the WHO and the political declaration of the UN high-level meeting. But what are the challenges we face? It is the recognition of you as a key actors and involvement them in action plans. That is why we must recognize the contribution and participation of young people as important actors in the fight to the NTB. Respect the diversity of young people and involvement them at all levels of actions. Mobilize and empower young people in the fight against TB. Young people should be involved in all fields and levels of action, such as community social surveillance, social mobilization, advocacy, accountability, and communications. I conclude my presentation by mentioning that in LAC, we, the youth, are united to NTV. Thank you.
Hello everyone, my name is Pumeza Tisile. I am an XLTP survivor from Cape Town in South Africa, and today I am going to be presenting some of the work that was led by TB survivors who were turned to be research assistants, so that is youth power to end TB. So at TB Proof, we aim to combine our stories with science, so I have no conflict of interest. So TB Proofs aimed to end the TB pandemic by building advocacy capacity. We try to mobilize resources for TB. We reduce TB stigma. Some of you may know one of our campaign, which was Anonymous Stigma. And we try to making health facilities safe. As you know, our healthcare workers are at more risk to contract TB. And lastly, we try to sort of like pursuing health equity. So here you can see that as we try to destigmatize all forms of TB through interventions aimed at improving TB knowledge in communities, and also by encouraging affected people to share their stories. So we are mostly known as a group of mostly TB survivors. And usually around TB Day, we have news stories that we share with everyone on Facebook, on Twitter, on our Instagram page. And we sort of like get a lot of feedback, and people sort of like reach out also that they want to share their stories because they see that there's nothing wrong for them to being TB survivors. So that is we try to destigmatize TB by having different stories from different people so that people can understand that TB can affect anyone, and also anyone who breathes is at the risk of contracting TB. So we did a project that was supported by Stable Partnership, where it was Use My Voice to End TB, whereby we're empowering community healthcare workers to contribute to a person-centered, gender-responsive, and stigma-free TB care. So the project aimed to address TB stigma through a gender-responsive stigma reduction intervention, and was a campaign based on the identified rather than the perceived needs of the community. So this study was conducted in a township called Kailicha. So we are trying to sort of like understand where the TB stigma was occurring. So we had anticipated stigma and acted stigma. And then we find it out that 18% of people actually experience anticipated stigma when they visited the hospital, the clinics, where they received whereby 50% of these people they received anticipated stigma in the community where they live, and over 10% of these people said that they received sort of like anticipated stigma in their own homes. So again, with the enacted stigma, as you can see, the numbers there, 13% said from the healthcare workers at the hospital or where they receive the TB care, whereby 11% said that people in the community where they live, and 10% from patients or other people at hospital or clinic, they received their TB care, which is member of their own homes and people at their workplace. So, as you can see on this slide, anticipated and internal stigma impacted each step of the TB care cascade, whereby enacted stigma was also experienced, but at a lower proportion of the study that we're conducting with our TB survivors in our communities. So as you can see there, from care seeking to diagnosis to treatment initiation and also treatment completion, some of these steps were sort of like delayed, and this is sort of like the stigma that impacted each stage of the TB care cascade. So when it comes to people living with TB, or rather when it was time for them to do care seeking, which is actually go to get tested because they think that they might be sick. So those people sort of like had some things, some negative things to say about themselves, that they sort of like internalize the fact that they actually might have this disease, which is TB. So they delayed it. The diagnosis was delayed, and that led to sort of like things being delayed to treatment initiation and also the treatment completion. And this is a problem. I mean, I don't have to sort of like I think people who attend this session are also TB survivors or people working with TB survivors. When it comes to stigma, it is sort of like very toxic, because even sort of like before we knew these terms, anticipated, enacted, and all of that, internal stigma, we used to use words such as self stigma, which is sort of like feel bad about even getting sick of TB because you've heard things or you've heard someone speak badly about this disease, a disease that you didn't even ask to have, just that you happen to breathe this disease and then you had it. And also with the media, you find out that it is written, it was, or rather it is, in some places it might be written as such as a poor man's disease, those things, and then it's usually associated with being dead and stuff like that. So people with TB sort of like always feel ashamed of having this disease that they call upon themselves. And yes, that is internal stigma. So when you have internal stigma, it is hard for you to actually go out there and seek care because you don't think you are good enough. You sort of like have a low self-esteem of having this disease. And even worse than when you go visit this clinic and hospital, and the nurses don't treat you as they should, like they treat you so badly that you feel bad about yourself, and that is a problem. So when it comes to sort of like having this TB cascade, and the stigma delays all of that because there is this internal stigma, And then there is this anticipated stigma that what might happen when I visit this place. And then when you do visit this place, you also get stigmatized. So that is a huge project, a huge problem. And we need to sort of like do better as TB survivors. We need to do better as doctors, nurses, and also our healthcare workers and community healthcare workers. So after this project that was concluded last year, so now we are busy with using a human-centered design to develop a counseling intervention. So we use these we have focus group discussions with TB survivors and healthcare workers. So like for instance, we gave this the last one where the guy is like this, like the nurse is like sort of like talking, shouting, whatever, and the TB survivors and the nurses interpreted it differently. Like for instance, with the nurses, especially from this third one, third card, which is this guy holding a hand like this and nurse holding a hand like this, the TB survivors were like, no, maybe the nurse is shouting at the patient because the patient is refusing to take the tablets for the patient is just there, maybe slowly, taking the tablets slowly because TB tablets are too much. And then when you did this focus group discussion with the nurses were like, no, probably the nurse is sort of like encouraging the patient to take their medication. So with those two things, TB survivors have their own perspective of the healthcare facilities they receive. They went to and then they received the treatment that they received, which is being shouted at and stuff like that. And then the nurses are saying that no, they were being supportive. They were telling the patient to take their medication, not really shouting at them. And that spoke volumes. And then now we are going to do another focus group discussion whereby we have both the TB survivors and the healthcare workers and see from them what are their sort of like a recommendation to sort of like minimize the stigma in clinics and hospitals. And we also found that the healthcare workers in the clinic that we were doing the focus group in Kailicha, that they say that they are overwhelmed and sometimes they are stigmatizing of the patient is not intentional. That's the word they use. They said it's not intentional, just that they are overwhelmed and they don't have the time to see everyone. They don't have the time to explain everything to everyone. And we also sat down with counselors and we found it out that the counseling that we thought was being done is not the one that we thought was being done. It was just like when we were just diagnosed with TB. After being diagnosed with TB, you are just informed about what TB is and you must take your medication and stuff like that. It is no way sort of like a support whereby you can sort of like a two-way conversation with your counselors, sort of like trying to tell them the things you're struggling with and stuff like that. Of course, also they say that they are struggling because they are under-resourced and they also do not have the time to talk to everyone. So sometimes they call people. So that is not the counseling that we thought it was. Obviously these counselors are not psychologists, they are not psychiatrists, just people who are there at the clinic, giving information at the time that is needed for the first person who was just diagnosed with TB. So again, we need to do better because people are still struggling with the stigma they experienced 10 to 20 years ago, even now. And then the counseling, it's not being done. There's a problem with post-TB counseling. We interview these people, we talk to these people, and you see that there's a lot of gaps that need to be filled. So yes, so as I said, yes, as a TB survivor, an external TB survivor, this was very interesting to know because we thought we are doing so much for TB, but we've learned that there needs, sort of like more things that need to be done to TB because there are like huge gaps that are missing for people to actually get the help they need when they have TB. So yes, thank you very much for listening. And yes, as I said, this project was funded by a Stupid Partnership in partnership with University of Stellenbosch here in Cape Town. Thank you for listening.
ماها اون کسی که به این بیمار گرفتار شده است به این بیمار گرفتار شده است بهترش همین است که ما دست به دست کنیم مثلا یکدیگر را در زیر طبابت بگیریم، در زیر دستگیری ها بگیریم. پروردگار مهربان همین سعی کوشش ما و شما رو میبینه و به او رحم میکنه و شفا را بده.
وقتی که بیماری سیر بودم داروخوریم به حد خیم بود، دست پاهایم کرخ میشد، بعض وقت داروی خودم را میکردم.
مهمان ما محمد جان عمرف نفره که از بیماری سیل شفا یافتند.
من این بیماری چیز رو از فکر خودم یک پوریکی، یک عذاب، یک دردی که با زبان گفتن نمی‌شود.
ما که روانی در برابر داروهای TBC گذاشتم و ازای سالین و بیمار ازای منظری می‌بخشیدن باعث شفای کامل در بیمار بودن.
سرکیم شکل میشد.
هر پستی و بلندی است از جانب خدا هست. ماهای خوف و خطر نداشته باشیم.
Salam alaikum. My name is Muhammad. I have 2 years of experience with MDR TB here in Tajikistan. Currently, I'm advisor board member of Stop TB Partnership Tajikistan, and I'm member of Global Coalition of TB activists. As you saw in the videos, I speak TB through all means of communication, television, radio, online chats, and in public events. And I'm hearing this global conference today. The challenges that we have include migration and refugees, COVID, regional and global instability, economic instability, uncertainty and confusion to understand the world. As such, we have always been having problem with heals behavior seeking, the link with education, and we have high burden of MDR TB in our region. What can we do as use power? We make friends with our decision makers, national celebrities, spiritual figures, and other. Let me show you another videos, a sample of what we are doing today. This is exhibition of my paintings. Mayor of city, activist member of our parliament, deputy minister, and donors attended. This is World TB Day event. Our TV messages go out through digital screens in our capital city. We mobilize secondary school and university students in the delivery of TB messages. We continue making news in national TV and radio channel.
با شخص بیمار غمخوری و مهربانی نمودن این یک رکن انسانی است.
Recently, we involve foreign students who study medicine in my country. They deliver TB message. Last month, we organized a charity concert led by our top-rated singers and comedians in one of our distant districts. About 5,000 people came. Chairman of the district participated in delivery of TB message. Screening for TB was organized during the event. This is flash mob we organized in one of the popular city malls. Two top singers participated gathering people and delivered TB message. In top right side, this is my picture with our NTP manager who is young, inspiring friend who managed TB program for 7 years. Below you see me with one of the experts with many years of experience. Elder people are our most precious resource and guidance. Lastly, I mentioned about uncertainty and confusion among years to understand the world. Our leader of nation says, Youth are the future of society. We say, let's help us make our future certain so that we help to build the future of our society. Thank you.